so there you have the new concept, one of those that are coming up, right? The symbolization of building psychic structure. And there you have symbolization of representation and internalization. So you have all that coming now as new concepts, as will be, and there are these teams. Please, if someone is interested, put also your name, email me, I'll add you to the team. And so, for instance, that would already be going in that direction. Again, organically, right? But that would be one of the aspects. Yeah.
I have a question. As you collect the different theories, certain theories, of course, lend themselves to certain types of interventions.
Mm-hmm.
So if you're using conflict theory, you're going to be looking at interpretation of defense and compromise formation.
Mm-hmm.
If you're using object relations theory, you're going to be using other interventions, about internal representations. And if you're using Lacanian theory, which I don't profess to know much about, but I know they have odd techniques where they end the session and throw the patient out after 5 minutes or something. They have some French word for it.
Well, that was just Lacan as a unique.
What I'm getting at is
Cut,
that,
right? They call it.
what's it called?
I think in English they call it the cut, or
The cut. There's a
I
word
don't
for
know
it
what
in
the
French.
French, the French word is.
But
for yeah.
No, there's some other
Oh,
Latin.
fancier word.
Yeah. But I think maybe as we collect the different theories, there will be some implication about what type of techniques would be used with that theory as a beginning before you begin to try
what is
to collect
interesting,
statistics about it.
yes, and well, let's say you have, I believe, the piece that you were contributing to EgoPsych. It's very interesting what Jerry pointed out as we were writing EgoPsych. And then we were talking together when we were there at a conference in Paris, and I said, well, this is what you have to add there. Because he was talking about the ego functions, right? Like part of what generally ego psychologists were just putting together over the years. And so now he had all the list of them, enlarged it. And then we were thinking, well, yeah, but that's like part of what the DSM or ICD anyway are now adopting, without citing, of course. There's nothing to do with psychoanalysis, right? It's purely descriptive. But this is already getting into the wider manual, let's say, or better parts of it, right? Now, yes. So, yes, there is an interaction. We just need to actually be mindful of that, and maybe that would be one of the dimensions of focus. Again, not limiting. We cannot have one focus. What seems to be emerging is that we may be in a position, because of this breadth of how we are approaching any concept, depth and breadth, right? That we actually may be in a position, kind of unique position, to again have that emerge within the concepts as a very natural sequel to this kind of a thinking. And it will then be more rich, it will be informed by variety and maybe sometimes contradictory. Again, a lot of the contradictions on a surface that become very interconnected underneath. Yeah, sure.
Yeah, I was just going to say that, in terms of, it's the application of analytic theory to technique is very important, but it's only one application. Like I think it's important to see that. I think maybe to state the obvious that psychoanalytic theory is not the same as its application technically, and also the evidential aspects are not just about technical interventions. Like we think about regression, let's say. The evidential aspects in relation to regression as part of normal development that Anna Freud talks about, or in adolescence. A lot of those are observational. Some of them might be therapeutic, but then you apply, or what Freud described as a formal regression in dreams. There you had again evidential aspects, looking at the way the dreams, followed from the manifest, followed from the latent, and he had a series of arguments about that. So that's formal regression or regression in trauma, breakdown of ego functions. So the evidential aspects, I don't think we should reduce, and I'm not saying anybody necessarily said that, but reduce evidential aspects to therapeutic interventional aspects, because then you have this broader theory, and then how it's used, as in any science, I think you have a very broad theory, and sometimes you don't know, like some of the ideas about regression, I don't think Freud knew, or that they could be useful in treating, let's say, personality disorders, which weren't even described in his day. So I think we have to, I'm not saying they're separate, but I really think and I think the Encyclopedic product is keeping that open, like the more scientific, broader aspect, right? But,
yes, and you have actually done in your work on trauma, I believe that you've done a lot.
on that sort of aspects. Like I think sometimes experience distant can have a negative meaning in present-day analytic theory, but it's an important part of every scientific theory, as long as you have the eventual inferential steps, from the experience distant to the eventual experience, obviously, even though the steps may be very many, right?
Yeah, and you know what? Sometimes it is a matter of wording, because the scientific thinking, right? The behavioral change, the operationalization, those are scientific sort of like natural science type of statistically relevant terminologies. And in some ways, when we work with an individual, and when there is a, let's say, unconscious to unconscious connection, of course we are not going to be thinking surface now what is going on, how to operationalize it. But again, it is not divorced from it. It is not broken away from it. And that is important to see that there are a variety of dimensions, and this is one very important one.
Well, it goes back to the organic experience of this material coming out. On another hand, from what you're saying, what we can look at in this regard is something that's very deeply needed, and that is a moving towards an understanding of defining the psychoanalytic process. Intervention and process. These are the things that are missing. We were in a recent meeting here in the DPE, and they were trying to develop standards.
What's the DPE?
The Department of Psychoanalytic Education, and they were saying, basically, does your institute ascribe to 3 times, 4 times, or 5 times a week? And most of the people in the room were saying it doesn't have to do with frequency, it has to do with getting a process ignited and moving. I was thinking of Otto's work, where 3 times a week is the top limit if you're in a severe borderline disorder. So it was the wrong question. The group was basically saying they knew that process was the answer, but they don't know how to define it.
Yeah.
And yet clinicians all over the world have their ideas about process, and this can be tapped.
Yeah, I believe that would be one of them, concepts that are coming up. But even just any of those new concepts, and any of the concepts that already have been actually part of the work. You have transference, you have countertransference, you have setting, psychoanalytic setting, right? Those are all elements or parts of the process. And now we are going towards the more technical issues, maybe, you could say, free association, regression, which happens and is deepening through that, and what happens with particular categories of patients during that, for instance. And that will be, and then building psychic structure. So you have a regression on one hand, and then you have building psychic structure. How do they interact? This is a very important dimension, and it is not to be approached in any kind of simplistic way. And that is, I think, that where psychoanalysis then can enrich even the field of research, actually. Because we do have latent level, many levels, right? an intrapsychic and interpsychic or intersubjective will interact. And then how does the process start, unravel?
I'd like to ask another question, because I'm very interested in Otto's idea. Otto, you have a manual already, a very lengthy, detailed manualization, right?
Maybe
You're
he wrote so many of them that you know, he doesn't.
Yeah, we do.
I have a copy of
I
it.
mean, yeah.
I don't use it. I don't refer to it.
I want to make sure it's yours.
Yeah, well, also, there is a manual in Europe. There's a guy named Henrik Hamrighausen's his name, Henrik Hamrighausen, who was working in Switzerland, where they have their own manual, as a psychoanalytic manual, about technique. So I'm thinking maybe as an appendix of some sort to what you're doing, you could have separate manuals from different countries.
Well,
From how they do it. You know,
that
how
would
does
be-
Otto's group do it? How does Henrik
I
Hamrighausen?
don't know that Swiss manual. Is it in German or
It's in
French?
I believe it's in German. His name is Hamrighausen, and it came out a few years ago. I can't read it, but you would be able to read it. I can't read it. It's the European Diagnostic or Technical Manual. I can write him and ask him to send it to you.
Yeah. Okay.
Yeah.
It's a manual on technique, of
I
psychoanalytic
believe
technique.
it's a manual.
I don't know that.
Yeah. He's in Zurich.
All the time in Germany and
Now, he's a German guy who's trained in Zurich,
yeah.
and he wrote this manual over
And
a
what's
10
his last name?
Hamrighausen.
Is it put together with any kind of
Yeah.
idea of research or effectiveness or results or
I don't remember.
outcomes?
Yeah, I think it was something like that.
You know, by the way, we are not exactly going against the history of psychoanalysis, because Fenichel, from rather early on, from 20s, already was doing research on the outcomes, right? He was tabulating
Right,
outcomes. That's right. They got, now, the criteria were variably defined, but they did have 80%. He tracked the results, and they had 80% improvement. Now, the criteria of improvement, the process variables, if you want to talk the research language, the outcomes variables, we could have issues with that, but the idea was there. Now, Fenichel is not exactly a renegade, right? It was somewhere in the back of the mind. He did the research. It was one of the first, actually, research studies. It was in psychoanalysis. I had that in my dissertation, so you know, real. And there were a number of studies that he put together, number of outcomes that compiled, and he had 80%, which of course Isaac then later on completely debunked, right?
A third.
Yeah, but there was obviously the idea. This is what is important also for us, that this is not like we are now just responding to the to this unprecedented kind of scientificism or reductionism, that it was on their mind. Yeah, go ahead. Yeah, you were thinking something.
I just commenting on the Wallerstein project, the Menninger Foundation, which in the 1950s started out looking for effectiveness of psychoanalysis and psychoanalytic psychotherapy. And one interesting finding was that to evaluate outcome in terms of psychoanalytic principles proved impossible. Our criteria were structural intrapsychic change. That's a highly respectable principle in psychoanalysis, where it was should ego be. we couldn't evaluate it in the patients. We had books of information, but it couldn't be. We had to go back to how do they behave in life. In other words, the outcome had to be measured in behavioral manifestations, not in intrapsychic changes that couldn't be evaluated precisely. Once we looked at the global aspects of the behavior, which then eventually came the global behavioral scale and the GAS scale that the American Psychiatric adopted, there we could do it, and all the findings were based on that overall behavioral assessment. Yeah. And so now we are very much advanced in how to study outcome. Outcome is no problem. We could do research any day. The problem is to define clearly what are we doing.
What
are our technical intervention? How do the intervention of psychoanalysis differ from those, say, of psychoanalytic psychotherapy or cognitive therapy? So you have to define psychoanalytic intervention very precisely. So when you observe the treatments, you can say, this was psychoanalytic technique, this was not. And that precise definition requires a manualization of psychoanalytic technique. This doesn't mean strict telling you what to do, what to say to the patient, but giving clear guidelines that are specific to what is psychoanalysis in contrast to what is not. That's what we need.
Yes, and I'm just thinking about the infant research, where they basically are tracking the minute movements, even just mimicking or gestures of those interactions between, let's say, mother and baby. So we may need to sometimes go, not necessarily to be on a camera, but to be able to track in those very microscopic ways what is going on for us and what informs actually our intervention. But I also want to say something about that, talking about the research. So there's a long history. There are problems, there were problems somehow gauging and maybe evaluating or sort of spelling out in some measurable values the intrapsychic changes. But we know when there are intrapsychic changes, and so then how do we know that, right? Because it is going to be coming up in the way how patients maybe form relationships, how they relate to us also, how they even think back then, how they are reconstructing or reevaluating how they were evolving or developing. And usually, as one of, talking about representation, for instance, now, next batch of concepts, usually as one of the outcomes, which is not very readily mentioned, is that there is a wider range of representational capacity. In a very kind of a general way, the patient starts talking differently. The nuances get expressed in more nuanced language, right? The black and white is not so. So there are certain, even just language, and I think certainly that French could be solved on, because they are so into language that you can track it in the way how the person expresses themselves with words and the tonality of it. There you have, of course, less than tangible measure, right? How people are also, sort of how much they think, how thoughtful they are, how nuanced they are, how...
Yeah, but you can have all kinds of development in that way, and a gap between them and behavioral change. You said that behavioral change has been the only thing that people can point to about what is, I think that's very interesting. You
Well,
know,
it
if
is
that's
the
the only thing we can
outward.
point to, then we know clinically that, you know, even as far back as the 60s or something, people like DeWall writing about, you know, what analysts think of and value, which is precisely what you're talking about. But the difference between that and what some patients value, you know, we know that there are patients who can behaviorally, you know, really begin to enrich their lives and not be so self-destructive, then their internal worlds, much to our frustration, don't really match exactly what we imagine and value and so on. So
Yeah.
it's very,
I think
I
that
don't know, it's a very,
whole subject is just so multifaceted, because if we really approach it as analysts, then we are so aware that obviously the internal world and the external manifestation of it are connected. They are not disconnected, so that when we say behavioral change, well, that will always have some correlate somewhere in their, we could say, drive life or ego organization, superego modifications and all that. So, and then how they all interact internally. But, you know, the larger categories that I was doing actually the research on those things years ago in Europe. So we had a category, for instance, insight. Okay, there was genetic insight. Then there was the there and now, the sort of interpersonal insight, and then the transference in the session, right here and now. Then we had behavior and attitudes, sort of that they might be connected. And that would be a large category. There would be a lot of very specific areas. And then symptoms, because obviously if the person doesn't like their symptoms, that will be subjectively bothering them. Although, let's say some characterological problems will be bothering their neighbor or their wife or their husband or their children, but will not bother them, right? Subjectively. So yes, you have all these all the variability of ways how to think about, but as a thought, as a dimension of what we are not excluding, rather that it should be limiting us, but that where we are branching more into and including that as a dimension. Because I think we are doing it anyway. We are not just sitting there with the patient, and we are making our minute clinical decisions based on that it would be somehow useful, right? That it would somehow enlarge something or grow something. The neutrality is essentially in terms of being on the side of a health, right? Our value.
The guy's name is Holger Himighofen, and with your permission, I'm going to send him an email copying you and Eva.
Oh, that would be wonderful.
Okay, and I seem to recall he had this.
Yeah.
I'm writing it.
Okay.
Okay. Sent.
You send it to
I
me
just
yourself?
sent it. Yeah,
Okay,
you
great.
can.
And it comes from you?
Comes from me.
Yeah, okay. So,
We'll see if it's the same email.
all right. Yeah, but the Leichsering and Rehbuch also from that was good German research published in New England School of Medicine on the dynamic therapies, that they actually are on par with the cognitive behavioral and humanistic and eclectic, right? That was the first actually mega study where psychoanalytically informed dynamic work was being credited as producing results.
That was Schindler,
Hmm?
the Jonathan Schindler.
And Schindler then still did more, kind of connected that with a lot of new studies coming from North American continent.
Well, and Barbara Milrod did a lot.
Mhm.
Richard Summers has a whole book about it.
All right, so, and there are certain categories again, right? Because they have to define then what is it that they are meaning by dynamic.
Can I have a couple minutes?
Of course.
One of the things about psychoanalysis, which is wonderful, right? It's a wonderful exercise. I'm trying to apply it in a forensic center. I agree with you, sir. How do you measure the change? I'm working in an institution. Inmates begin to pick up my language. I change the language continuously as much as I'm able to, and they seem to follow that.
Mm-hmm.
I do risk assessment. Always I'm asked the same question. How do you know that what you do works? I said, well, the only thing I have is what I see within the group. It is a suppressing situation. You all seem to be talking about epistemology. How do we know that what we know is that there is to know? I cannot argue and say to a judge, linguistically they are wonderful. They know about their mothers, they know about their fathers, they've learned about infantile sexuality. And always the question is the same, doctor, but are you sure that they will not assault outside? I don't. And we have all kinds of statistical measurements. They're useless because they all have to do with what I see in the environment. What's missing for me is the application in forensic settings. The institute in Chicago is offering $15,000 prize for good paper on the application of psychoanalysis in the forensic setting.
Really?
I just picked it up. I would have done for the $5,000.
I'll send them the book that you have to translate.
It's too late. I do
You just wrote a
it.
book about pedophiles.
Excuse
Would
me?
they be interested in a book about pedophiles?
Yeah, but since we talk about that, it would be good maybe to differentiate between infantile sexuality and pedophilic sexuality.
Well,
Is
that
that-
would certainly go under the infantile sexuality.
So that should include regression.
Should include.
Regression. In the regression, we should have it.
So it depends how then, how it develops.
If that's a new topic, I'd like to be involved.
Yes, okay,
All right.
very good. It is a new topic,
Okay.
yes. Yes, now you are bringing a very important piece, also aspect again of this encyclopedic work, and in connection with what we are talking about now, that Otto brought up, that especially the relevance of psychoanalysis to applied areas, right? Where can it be applied besides our office, besides the individual work? And while this lives essentially in the, I think, cultural zeitgeist, and is evolving as part of it, and then informs it back, right? That there's a kind of reciprocal relation. But there are applied fields, and this was already Freud's idea, that essentially they can enrich the thinking of the analyst, and analyst can enrich the thinking of whatever the connected field, like art, anything else, culture, society, sociology. But there are, then the more we can be specific again and sort of translate what we are talking about into, you can say either operational language or sort of a, again, language which could be then applied in variety of other fields, that would then, that would be very important. And then how do we pick that up with one individual patient? How do we pick that up in a group analytic setting? How do we then apply that and how we document? What I actually find fascinating is that the Chicago Institute actually would put the two and two together. That psychoanalysis, because it after all does deal with sexuality somehow, right? Is maybe in a good position to come up with something but they don't have yet.